6.85%, 7.2% over the last week or so. That number has gone up quite a bit, and we'll talk about that in a minute. Hospitalizations up 100 over the weekend, up to a total of 837. So what, if any, what can we read from this that's a little bit different than where we were before? I think you should realize that unlike a year ago or 2 years ago, we're in much better position because we know how to defend ourselves, and we know that what works. We know that masking works. We know that vaccinations work. We know that boosters work. We know that it's a little frustrating, I got to admit. We were the most vaccinated, least infected state in the country going back a couple of months. What happened? I thought vaccinations meant we were bulletproof. Well, not quite. You can still get infected, but you should realize that overwhelmingly our infections are related to people who are unvaccinated, even more so in terms of hospitalizations, but you can get infected. So we have gone from one of the least infected in the country to, say, about 13th nationwide. Not good news, but you ought to realize that our vaccination program has really worked. So while we're 13th when it comes to infections, we're middle of the pack when it comes to hospitalizations. So there's now a disconnect between infections and hospitalizations. It used to be just a 2-week lag. We don't think that's going to be the case this time, and that's extraordinarily good news. So if a year ago we had, say, 1,200 hospitalizations, today we're at 837. Not particularly good news, but you can see it's beginning to make a difference. And the disconnect is even more dramatic, thank God, when it comes to fatalities. If we're 13th highest in the country when it comes to infections, we're 37th highest, or, the bottom quarter when it comes to fatalities. And we'd be better, but, given seasonality in the South, everything's gone. Compared to our peers in the upper Midwest, Northeast, our fatalities are much lower. So the message I want you to get is how important the vaccinations are. And in my mind, to be fully vaccinated, that's 3 shots, when you're eligible to do so. The 837 folks who are hospitalized for COVID-related, fortunately, people are spending a little less time, according to the hospital CEOs, in the hospital with that. And you ought to remember that we have about 7,500 beds. So when it comes to capacity, most of the capacity issues are related to this being the flu season, and more people go into the hospital for other related ailments, not necessarily COVID. But this is something we continue to watch very carefully. Let's look at this next chart, which is the national COVID-19 trends. I think you kind of can remember from a month ago or 2 months ago, the South was very red, and the North and North Central were yellow. Now we've got the mirror image of that. What's interesting in this? I think you should realize that Omicron, we're getting hit. We're getting hit by Omicron coming up from the south and Delta coming down from the north. So that's why you see, Connecticut's got a bit of a bullseye on it right now. But some of the little things to realize about Omicron right now is, as you've obviously read, it looks like while it's much more transmissible, it is probably much less virulent, much less risk. In many cases, more likely to be, a bad case of the flu, especially if you're somebody who was previously vaccinated. We can see it came out of South Africa originally, and the only reason I say that is we're going to have to learn to live with these different variants over a period of, many months, I fear, because the rest of the world is not as vaccinated as we are. So there's more opportunity for mutations, more opportunity for these variants to come along. What you should know about Omicron is it rips through like a wildfire, but at this point things are stabilized and on the way down in South Africa. Up next came Britain, and they were on fire as well. It looks like early indications are there may be some stabilization there as well. So this gives you an idea that Omicron, best case scenario, is that, vaccines work, boosters work, more mild, more infectious. It may go through our system over the next, month or two. Maybe more people have a mild infection, building up some immunity. These are just some of the things to think about. I'll give you one other thing. If you look at this map, which I find interesting, is some of the states that have the most restrictions, let's say New York State, New York City, mask, and they've had, vaccine requirements to be able to get in the restaurants and the such. I like to do things that work. New York and New Jersey are ground zero for Omicron right now. So you can't stop what may be happening there with a lot of additional restrictions and mandates. What you can do is remember how important vaccinations are and wearing the mask when you're not with people that you, know carefully and what their status is. So I mentioned testing, and I've heard the concerns, hey, I want more testing, I want it to be easier, I want it to be faster. I mentioned to you that the numbers are way up in terms of people getting tested. I think that's a pretty good thing. We have 400 sites around the state right now where testing is available, usually available, on demand, no questions, no cost. State-sponsored testing expansion. We're expanding the hours at many of our sites, make it easier for you before work and after work. We're adding on additional sites. I've had good conversations with the pharmacies. They are going to be expanding testing as well. Drive-through, no appointments necessary. Very important there. Hospitals as well, as you can see, they're expanding testing. So I think give us a couple weeks, but we are expanding testing every day to make that more available. And by the way, right now we have tens of thousands of teachers and paras and folks who work in state government, and we're going to pause their mandate for testing just to give a little more flexibility for them and make sure that we have a little extra capacity to provide for testing going forward. So right now, as you know, the CDC rules are if you test and you test positive, you stay home for 10 days. We'll see if that changes. We'll see whether there's a test out option. Right now, those are the rules. And if you have you got sick days to help accommodate for that. And if you have something that gets you to the hospital, you got to know if you're not covered by insurance, you do have paid medical leave that kicks in starting in about 10 days here in the state of Connecticut. Give a little more confidence that we got your back and that you're covered. All right, the next chart, surge is overwhelmingly impacting the unvaccinated. I think we know that. People keep telling us that. I think the difference is here, now back a year ago, there was one line, and that line was going like that. We were trying to flatten the curve because nobody was vaccinated. We were defenseless against COVID. We're no longer defenseless. So that yellow line is the folks who are not fully vaccinated. You can see you're many times more likely to end up hospitalized and end up worse off if you're unvaccinated. And you should see the fully vaccinated line. That's that blue line at the bottom. You ought to see it really hasn't changed that much since, mid-August. That should give you some confidence that most of this risk is in the unvaccinated still, a very narrow cohort that we have here. Some breakthrough for folks that haven't gotten the booster. Maybe they got, their 2 shots of vaccine well over 6 months ago. Be fully vaccinated. This is what you got to do. The only thing I really watch carefully is hospitalizations. Make sure we have capacity there. Manisha, Josh, and I talked to all the hospital CEOs, I'd say, last Thursday. They feel pretty good, very confident. They've got the beds. They've got the capacity. Little worry about burnout of nurses and docs. Manisha's been ahead of the curve there. She's putting in place a 60-day licensing waiver so that nurses and docs from less COVID afflicted areas can come up to the Connecticut and give us some relief. I think that will make a difference. Also, we're talking about ways that folks provide some support as well. As you can see over the it's an added convenience and it's secure. That information by law by contract, cannot be sold, and cannot be dispersed. It's compatible with New York and other states in the region. Massachusetts and Rhode Island will be adding on the same capability as well. It's really a plus. I mean, down there in New York, it's so that we can make it easier for you to be able.
NBC Connecticut.
Good afternoon, Governor Matt Austin with NBC Connecticut. I had a couple questions about the health card, but just first off, as folks are gathering later this week for Christmas and into New Year's, when they hear about the hospitalization rate going up, I guess what is your message for them? What do you think, holiday gatherings should look like?
I can tell you the gatherings I've been to where I didn't necessarily know everybody that was going to be there. People generally asked to see our vaccination status, and many of them said, I want to see that you've been tested 24 hours in advance. And I think that makes a certain amount of sense. For those groups that I know, my family, my immediate friends, I know what their status is already. I think, assuming you're fully vaccinated, I think you should feel comfortable enjoying the holidays. Just do it cautiously. If you're in a crowded place, you don't know everybody there, put on the mask.
And in terms of the health card, I know you were trying to stress that it is voluntary and optional, but at this point, are you closing the door on local communities enacting their own mandates like New York City and Boston have done?
Well, that's interesting because we've generally allowed our municipalities the flexibility to, for example, mandate masks for indoor settings, and we haven't done that. We figure they know, their populations the best. I gave a lot of discretion, say, to our restaurants and stores because they know their customers the best and know what that is. Let me think about if a municipality has that option as regards the vaccine smart card.
And then just for the health commissioner, if you're just able to address, we have seen with Omicron a lot of breakthrough cases. We've heard anecdotally where large gatherings have had breakouts among vaccinated guests. So I guess just can you talk to people, how safe should they feel if they go into an establishment that does have a vaccine requirement, and does it potentially lull them into a false sense of security?
So I do think that Omicron has shown itself to be highly infectious, and as you mentioned, there are people who have had breakthrough infections. What I think vaccinated people can know so far is that vaccinations certainly are going to protect you from more severe disease. But if you are in a setting with a lot of people that you do not know, and it's indoors, I still strongly advise that you wear a mask, because I think because of what you just described, wearing a mask in those settings is going to be what's going to be most protective.
Okay, thank you.
News 8.
Good afternoon, everyone. Governor, you mentioned about giving discretions in the past for each municipality, but as you talked about with yourself, you like the idea that when you go into an establishment, people are asking you for proof of vaccination. Would there be a point where maybe you decided to mandate that?
No, I don't think so. I'll tell you why. The folks who enforce it and who know their customer base the best are best able to make that judgment. I was looking at, Governor Hochul down in New York, and she mandated, proof of vaccination status and masking requirements, and, Long Island said, we're not going to enforce that. And I think you found mayors and first selectmen across the state said the same thing. So you've got to work with the local municipalities. You've got to work with local businesses and restaurants, since they're the ones who are going to be enforcing it.
There's been obviously a big trend of more people wanting to get vaccinated, and as you talked about, many locations for them to get vaccinated. With regard to hospitals now, does that help pick up the slack because SEMA-4 is no longer an option?
That was a little faint for me. Did you hear that, Josh or Manisha?
I can repeat that.
Yeah,
With
thank you.
with semaphore not being an option now, is the idea about hospitals providing some testing as well. Is that a way to pick up the slack since SEMA is no longer an option?
Yeah, Manisha?
So, first of all, Semaphore is going to be extending their testing until the end of January to allow DPH some additional time to get replacements for them in terms of the sites that they are providing testing at. And we had competitively bid for vendors who are ready and willing to pick up those sites. And so over the next several weeks we are going to be identifying, and this is for the 23 existing state sites, and then the additional new ones that we were setting up to have a total of 30 state sites that we will be able to do with vendors that are already agreed upon in terms of with DPH. So additional hospitals may be opening up additional testing opportunities, and that may be another source, but at least for the state-run sites, we will have a plan in place to be able to pick up those sites.
One more for the governor, if I can. Governor, you talked. I know there's been some opposition about the security in terms of the cards. Can you repeat what you said before about why there's no chance on people's information being sold to third parties?
I can. We got enough real problems. I don't need people making up problems. Josh was very strong on this. Per contract, that information is private and will stay that way, and otherwise they're breaking the contract. But Josh, you want to add to that?
No, that's exactly right. I mean, it's explicit in the contract, and the information is no different than what's on your paper vaccine card. So, it's very clear with regards to the Smart Health Card that data is very secure. For people who are concerned about this topic, though, they may want to look a little closer at all the other apps on their phone and what they're up to. I think there are other, perhaps more significant privacy concerns people may want to look into.
Channel 3 Eyewitness News.
Yes, Governor, a real quick question about masks. Looking at that COVID map, it appears that we're really right in the middle of a COVID hotspot. So why not an indoor mask? I know that you mentioned New York has one, and they're also right in the middle of it as well. But it does seem like it could be just an added layer of protection.
An added layer of protection if people do it, and it can be enforced. And right now, I love giving people an incentive to get vaccinated and boosted, and gives them a little flexibility there. I'm sort of a big UConn fan these days. I was looking at the basketball game at the XL the other day, and you're supposed to wear a mask there. Not everyone was wearing a mask, to put it mildly. So I can pass a lot of laws and mandates and restrictions, but they're only effective when people follow it. So that's why I like to give that local discretion, and they know their population's the best, and they're the ones responsible for enforcing it.
Are you concerned at all about hospital staffing? This variant appears to be more contagious, and it could result in some hospital workers not being able to show up to work, and that could have an impact on the care that patients get. And I know that you're going to be bringing some in from out of state. Are there any other measures, and do you expect that our hospital staff could be impacted by this variant?
Hospital staff are exhausted. They don't get any time off. They're going nonstop. Thankfully, well over 95% of them got their two-shot regimen. I don't know what percent, Manisha, have gotten a booster at this point. Again, I try and use encouragement at this point wherever I can, because I can't afford to lose, any, in this case, nurses. Anything else on that, Manisha?
So the individual hospital systems are working with their particular employees to try to get as many people boosted as possible. And so we don't have tracking across the state on healthcare workers and nurses. We can say that for the long-term care industry, about a quarter of staff have been boosted so far. We are continuing to work with members of that industry to make sure that people get boosted further and are looking into more options there as well.
Thank you.
Fox 61. News 12 Connecticut.
Good afternoon. You know, a year ago there was so much focus on what states it was safer to go to and what states you had to quarantine before and after. Now with Omicron, you know, being dominant in some areas and not as dominant in other areas, do you want people thinking about that as they get ready to pack up their cars and head off for Christmas?
Well, right now, we're sort of relatively more infected. If I was thinking out loud, I'd say New York and New Jersey, given the great spread of Omicron there, I'd be a little hesitant myself about going down there. I can't enforce, quarantines or anything. I'm not going to try and do that, but that would be something I would think about. Otherwise, when it comes to flying, you can go to Florida. They have a very low infection rate right now. Maybe it wasn't that way 8 months ago, though.
You also mentioned you now consider boosted or 3 shots sort of the standard for being considered vaccinated. Is that something you're looking to make official in the sectors where being vaccinated is required?
Not at this point. Again, I can't afford to lose any nurses at nursing homes or nurses at hospitals. And if there's a trepidation about, the third dose, I have to take that into account. But, if our hospitals are overwhelmed, we may have to take a second look at that.
Thank you.
Connecticut Public Media.
Governor, it's Frankie Graziano from Connecticut Public. Just wanted to reach out regarding recent news that children 2 to 5, the vaccine trials here have basically failed. So it looks like that won't come for a while, and we've heard a lot of doom and gloom about folks that are not fully vaccinated. So what do you have to say to parents out there with children who are unvaccinated at this point?
I'll start and then hand it over to somebody who's devoted her life to infectious diseases. If I had a 2 to 5-year-old, make sure that he or she is always around people who are fully vaccinated. Keep him or her safe, and maybe even a mask. But Manisha?
Yeah, I would just say that it's unfortunate and discouraging that children 2 to 5 were not able to be shown in the studies so far, but that's why we do studies. This is why we do the science. This is why we do the trials, because when the vaccine will be ready for prime time for them, it is going to have been shown to be effective in clinical trials. So as disappointing as that is, I think this really just shows us why science is so important and why trials are so important. So for many families, there are still many children between the ages of 5 to 17 who need to be vaccinated. Get the rest of your children vaccinated. You will help protect the younger children, and hopefully, in another few months, it may take a little longer than that, we'll be able to see some more positive news for a vaccine series that will work for our youngest children.
Thank you.
The Associated Press.
Thank you, Max. Good afternoon, everyone. Governor, I got an email asking how can high-risk people who, or maybe even the elderly, if they become COVID positive, how can they access the monoclonal antibodies that they get GlaxoSmithKline has manufactured? I guess they're very limited in supply, and are we expecting supplies beginning tomorrow?
Manisha?
We have plenty of supply in the state for monoclonal antibodies. The key would be to talk to your physician to start, and would be able to be referred to one of the centers where monoclonal antibodies are infused. and where it can be prescribed. So there are many different settings in which this can be done. It's really most important to talk to your doctor first to be able to help facilitate that pathway.
So there's no one at DPH they should be reaching out to?
Not directly at DPH. DPH receives inventory of how much is being allocated to the state, and it goes to specific sites and providers. And in the allocations that we've seen, we have for a long time, because we went through a long period of a lot of success with lower cases, we've had a lot of stock in terms of monoclonal antibodies. So this is not something I'm concerned about people having access to, and people should really talk to their doctor to be able to get access to the medication if they need it. The one
Great,
thing I
thank
would
you.
say, I'm sorry, the one thing I would say is that there are certain areas where, you know, because we see the unvaccinated being the people who end up in the hospital and taking the longest period of time, sometimes it is being, in certain centers, more targeted to people who are unvaccinated, but that really depends on the area and the district, and really talking to your doctor is going to be the best way to figure out how to be able to have access, and particularly if you're older, immunocompromised, even if you're vaccinated, there may be more reasons why you may be eligible. So it's going to depend on the local area near you where you have access to it.
Okay, great. Thank you for that. And do we have a percentage of how many inmates have received a booster shot, and what is being done to make sure that inmates get boosted?
Sue, I know that it's being offered. I don't have the exact statistics on how many have taken it up yet, so we'll have to get back to you on that.
Okay. And I just had one other question too. Governor, you said something about a pause on the vaccination requirements. Can you explain that a little bit more? Does that mean anybody that is required to get tested or vaxxed, they will have to do that for 2 weeks?
Yeah, to answer your question, we're going to pause the enforcement around the vaccine mandates, not for hospital workers, just to be very clear, and we're going to continue offering testing in our prisons and our hospitals and other high-risk congregate settings, but for all the others, office workers, educators, many of whom are going to be on vacation for some of the next 2 weeks anyway, we're going to pause enforcement, and what we expect that will do is free up a little bit of additional capacity for other residents of the state who are actually symptomatic or who are exposed, so that they can have a little bit quicker access to testing. It's tens of thousands of tests a week, so it's a meaningful number. And with the holiday period coming up right now, we think it's a smart move just to give them a little bit of extra flexibility through the holidays and to free up capacity.
Okay, great. Thanks a lot. I appreciate it.
CT Examiner. The Hartford Current.
Hi, Governor. It's Eliza Fawcett from the Current. You mentioned that the state is expanding testing capacity. When are those 7 additional sites going to be added? Right now, most testing sites don't have any appointments until next week.
You know that, Josh? Manisha?
So for the 7 new sites, 1 will be starting this week. 1 is on the New Haven Green. This is saliva testing. For the other 6 sites, we are looking at over approximately the next week for the rest of those testing sites to be able to come online. But again, if people remember that for these state-run sites, particularly the 23 that are up and running already, with the pause of enforcement for testing for many of the employees that Josh identified, when we look at our state testing that is done at our state sites, about half of them are based on employees. So we're freeing up a lot of capacity for people to come to the state sites to be able to get tested if you've been exposed or if you're symptomatic.
Thank you. And Governor, you said that hospital capacity isn't at a level we need to worry about right now, but some hospital officials have been saying they're increasingly full and concerned as they confront this surge. How do you reconcile that?
Well, we talked to all the hospital CEOs just on Thursday, and we walked through almost hospital by hospital what the demand looked like there. The biggest increase is, not just on the COVID-related, but all the other surgeries, posts that are going on right now. And so that gives them a bit of a dimmer switch in terms of being able to control access and make sure that nobody is denied a bed when it comes to serious COVID-related. And if something changes, we'll be the first to know. Manisha's in very close contact with the hospitals on a practically daily basis now.
Thank you. And just one last question, Governor. Are you concerned at all about the potential for a COVID spread during church services surrounding Christmas? Would you at all encourage remote services?
Yeah, I'm concerned about all that. But it doesn't have to be. And you can keep yourself safe. And if you're going to a church service, don't test after the service. Test before the service. And that way you know that everybody around you will be safe. And obviously, I hope you're fully vaccinated with the 3 shots. And probably a good idea if people of a certain age to wear a mask as well. So I'm not worried about church services by definition. I'm worried about people not taking what we know works, taking that seriously.
Thanks very much.
The Day of New London.
Thanks, Max. Hi, everyone. Governor, if you have one, what's your opinion on Rhode Island's new indoor mask mandate, and what would it take for you to put something similar in place?
Well, I think I mentioned we have an indoor mask mandate, as I understand it, at the Excel Center. And you can pass laws, you can have mandates, but what's really important is people understand themselves how important it is to do the right thing. So I'm not positive that yet another mandate will make a big difference there unless circumstances radically change.
Thank you for that. And just one more thing. Can the health commissioner elaborate on the plans the governor mentioned to supplement hospital staff due to burnout?
So what we will be doing is issuing a 60-day waiver of Connecticut state licensure for certain professions, including physicians, nurses, certain social workers, psychologists, and there will be a full list of professions that we'll outline tomorrow. This will help with telehealth for people who has established relationships with people outside the state, but also would allow for people to be able to come and practice in the state, because if they don't have a Connecticut state license, they could do that for 60 days. Beyond that, they will need to have a Connecticut state license, but this is something that in the short run we can do to help alleviate at least that restriction.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Dr. Giuffani, we're about 150 people from hospitalized patients from about halfway from that April total, the high point. When do we start thinking about stay safe, stay home again?
We're in a different situation than we were a year ago with vaccinations the way we have them. Having said that, I am very concerned and watch these numbers of hospitalizations very closely. I speak with colleagues that I have throughout the state, ICU physicians, hospitalists who are taking care of COVID patients, and other types of patients throughout the system. We have people who've been sitting on the sidelines with medical and surgical conditions that need to have them treated. We have a behavioral health crisis that's going on, and we are in the middle of a COVID pandemic. We are going to be watching this very closely. As the governor mentioned, I am in very close contact with the hospitals, and we assess this really on a daily basis to identify what may need to happen and what kinds of steps we or they may need to do. So we are really working in a partnership with them to be able to help keep our citizens safe and healthy.
Doesn't sound like you've got a particular number in your mind then.
I don't think a particular number of COVID patients is as relevant because of those other situations that I described. We have a workforce that has been working very hard for almost 2 years. Staffing matters significantly. We have a behavioral health crisis going on, And we have medical and surgical patients who are also in the hospitals right now. It's not just about COVID patients. So we really have to look at the total picture. It's not just one number of COVID patients. Having said that, of course, that COVID number is driven by unvaccinated people who make up 80% of COVID patients who are in the hospital. Throughout this summer, we had people who were in the hospital. The hospitals were full with other medical and surgical conditions anyway. So the COVID numbers matter because it's in excess of what the normal capacity is of a hospital. And I am concerned about it, and I try to address this every single day.
Have you and other epidemiologists gamed out how many people in the state may get infected to one degree or another?
So what we know with Omicron is that it is highly infectious. It will continue to spread. I think it remains to be seen how it works with Delta, but it is possible it will outcompete it. That's what many of the models seem to suggest. And I think many people have seen that they know a lot of people around them right now who may have COVID. Granted, for many of the vaccinated people that I know, they are recovering well. They may not feel well for some days, but they are recovering. For those that are having breakthrough infections, unfortunately, for those that are not vaccinated, we're seeing more serious outcomes with the number of hospitalizations that we see. So I think we have to remember that vaccinations and mild infection, if that's what it comes to, is a win for us and for the state. And at this point, we're going to need to continue to watch how it goes. But I'm hopeful that we have the tools in front of us to be able to get through this next surge.
And going forward, are we going to look at the term fully vaccinated and just assume that it's a booster also?
So the CDC
Sorry.
has yet to change their definition, but I think practically we can see that immunity wanes after 2 doses, and everybody 16 and older can get a booster now. And so if you are looking to be protected to the most that you can be, you need 3 shots.
Thanks. And Josh, how many employees have been separated at this point over the failure to comply?
So since the state employee vaccine mandates went into effect, we've had 153 terminations and 144 employees placed on unpaid leave.
And finally, what's the percentage of Department of Correction guards who have been vaccinated offhand? Josh, if you know.
That is up to 66% of our DOC staff is now fully vaccinated, so it continues to trend in the right direction.
CT News Junkie.
Thanks, Max. Governor, you spoke earlier about in a couple weeks you should have an expanded testing capacity. Are you concerned that there isn't adequate testing right now, given that people are trying to kind of plan for get-togethers, holiday gatherings, that kind of thing?
I think I was being conservative. I think we're ramping up the testing a lot. Manisha mentioned we've already got it now right there at the New Haven Green. I think I'm working very closely with the pharmacies. I think you're going to see a lot of expansion there pretty soon. So we're working as fast as we can. But, you know, your point is well taken. Maybe people go on a vacation and stuff. There'll be one last big rush to get tested. We're doing everything we can to ramp that up. And so far, you know, we're handling probably 30, 40% more tests today than we were just a couple of weeks ago. And I think we're getting by.
Have you guys given any more thought to at-home testing, so supplying at-home tests to Connecticut residents as some other states have done in countries?
Well, I'll start with that. You know, right now at-home tests are sporadically available at, you know, your local pharmacies right now. We're trying like heck to get more at-home tests here to the state of Connecticut so we make them more broadly available. The question is not how you distribute them right now. The question is the supply of getting more, you know, fast, instant at-home tests. Josh, anything to add to that?
Sure. Just to say that it is something that we're looking at. You know, we are a little concerned if you distribute them widely and kind of across the board. A lot of them end up sitting on shelves or going to waste. So that's why we've really been focusing our efforts in the short term on scaling up readily available, immediately available testing capacity by expanding hours at our existing sites, adding more sites, increasing capacity through the means we've discussed. But it is something that we're looking at, different scenarios, a little further out in the future.
Okay. Thank you.
The Connecticut Mirror.
Hi, Governor, on the question of local authorities being able to require proof of vaccination, I want to clarify that. The ability for them to mandate masks, as I recall, is the result of an executive order you issued, correct?
That's correct.
Okay, so is there currently any authority under which a local, a municipal official could begin to mandate proof of vaccination? And I'm not talking about private venues, that's been established, but I'm talking about either a local health director, first selectman, mayor, and so forth.
That's a good question. Over to you, Josh.
So, Paz, we have looked at this. Towns cannot currently order a town-wide vaccine mandate or town-wide proof of vaccination to enter private places. Towns can order that for their own employees, as some have done, or for town-owned buildings. So that's where things currently stand, and we're aware of this can vary a lot town by town because different towns have different ordinances and so forth. But that's generally where the state stands at this point.
And so, Governor, back to you on that. Do you have a position at this point as to whether or not they should have that authority?
I don't have a position on that as yet, Mark. I just was thinking about it when the question was asked previously. Instinctively, I like to give local authority to mayors and first selectmen to make up their minds on this. A little opposite of what they do in Florida and Texas, where local businesses and local mayors and local principals are not allowed. And in fact, they'd be fined $1,000 if they told people to wear a mask or show vaccination status. I think that goes the opposite direction.
And a question for Dr. Jadhani. Right now, there are certain circumstances under which people must get tested. Certain travel, perhaps going to a hospital for surgery, whatnot. When it comes to discretionary testing, can you articulate a reasonable criteria in your mind as to when people should get, if they are asymptomatic, I'm talking about, when people should get tested as a precaution against spreading the disease to their loved ones or perhaps the broader public?
I see the role for that largely in the example you gave of trying to protect your loved ones. So we know that there are certain settings, for example, in colleges where maybe colleges have said that students should get tested once a week, twice a week, things like that. But I think for the average person, the average citizen of Connecticut, I would say if you're gathering with loved ones and you want an extra precaution beyond vaccination, boosting, that doing the test before you gather is one more thing you can do, particularly because we are in a phase where we have a lot of spread with likely Omicron overtaking Delta right now and being very infectious. So I think those are the types of settings, particularly as people are getting ready to gather for holidays, that I think it is a reasonable thing to do. The other thing people can continue to remember, none of us want to have to wear masks around our loved ones, but if you have a very immunocompromised person in your household, there's certainly nothing wrong with continuing to do that, to just add an extra layer of precaution.
The state, I thought, had a goal at one point of having booster clinics at long-term care facilities by the middle of the month. Has that goal been met?
Yes, that goal has been met, and we have been able to have that in all of our long-term care facilities.
Thank you.
All right, I'm getting the signal, everybody. sorry we're still having this discussion. I know it's getting exhausting. I hope you have some air of, hope that this year is going to be different. It's going to be a better Christmas, a better holiday season, and you can go about your lives safely if you take all the necessary precautions. This may not be the last variant that comes along, but I think we know how to handle it and handle it better. And I just have a special shout out. I mean, we're all looking forward to a break. It's been a pretty, exhausting time, and these holidays are a good time to put your feet up and take a little bit of a break, and I hope most of you are able to do that. Just remember those that can't. Remember the food service workers, the groups we always used to call essential workers. They're showing up every day. Remember the corrections officers. They can't take a day off. They can't telecommute. They can't wait until they feel a little better. And in particular, remember the nurses and docs. I think more important than ever before, we remember that their busiest time is going to be this next week and this next month, and they have no choice but to show up, and thank goodness they do. Take care, everybody.